Okay, so today I live alone. I have no pets. So my patient is Lammy from my childhood. She's the only stuffed animal I own. So let's get started. Okay, so I'm going to give you some instructions before you leave the hospital today for both you and baby. Mom, we're going to start with you. So first things first, we're going to worry about your diet. Nutrition is essential for your body to heal. You should eat foods high in fiber, which include bran, broccoli, cauliflower, and fruits to help your bowel movements become regular. Eat foods rich in calcium, which include dark green leafy vegetables, milk and yogurt. Also drink plenty of water and non-sugar supplemented juices every day to satisfy your thirst and maintain hydration. Avoid soft drinks, coffee, tea, and alcoholic beverages. For your activity level, we want you to gradually increase your daily activities until you're back to your normal routine. Make sure you rest frequently. No lifting, pushing, pulling for the first 2 weeks or as instructed by your physician. Do not drive until you are released by your physician as well. Next, we're going to talk about your breast care. Your breasts and nipples may have changed and or grown in size during the pregnancy. That's okay. Wearing a well-fitted supported bra day and night may be more comfortable as your body adjusts to the changes. You can wear breast pads while until your breasts stop leaking. Leaking may occur several weeks to months after. You may apply ice packs between feedings to ease discomfort. Breast care for patients who are not breastfeeding. We want you to wear a well-fitted supported bra at least 3 to 4 days following the delivery. Refrain from stimulating the breasts and nipples. Do not pump breast milk or permit the newborn to suckle to alleviate the engorgement. Apply cold compresses in the form of frozen wet towel, cold packs, or ice packs every 15 minutes. For 15 minutes at a time every hour as needed. To prevent tissue injury, do not apply the cold directly to the bare skin and do not apply heat to the breasts. We also don't want you to massage them. So some breastfeeding tips for you. Your baby's mouth should form a tight seal. The lips should be against the areola, not the nipple. And if the baby is suckling incorrectly, slide a finger between your baby's lips and your breast to break the suction gently. Reposition and try again. If you're wondering how long normal nursing should take, it's as long as your baby wants. It's usually about 10 to 30 minutes, and at first your newborn will probably want to nurse many times in the 24-hour period. It's important for the health of your breasts to have your infant feed from both breasts every feeding. Good signs of proper nursing is hearing that your baby is swallowing. You don't want a clicking sound when that's happening. You want to see movements above the baby's ears. The ears may even wiggle. And not seeing the dimples in your baby's cheeks. You and the baby should appear calm and relaxed during the feeding. You should feel gentle tugging at the nipple, but no pain after the first few minutes. If there is pain, it may mean the baby is not positioned properly, that the tongue doesn't extend past the lower jaw. Remove the baby and try again. Okay, so as far as hygiene goes, we want you to wash your hands frequently when you're caring for yourself. This prevents infection. Always remember to wipe front to back after going to the toilet and clean your bottom with the warm tap water using the Perry spray bottle that we'll be giving you. Make sure you do this after urination or having a bowel movement. It's important that you change your pad frequently. For bleeding concerns, vaginal flow will decrease in an amount from bright red to pinkish or brown to a yellow or cream. Your menstrual period may occur as early as 6 weeks to 2 months after the birth of your baby. For your bowel movements, try to avoid constipation. You may take a mild laxative or stool softener until bowel movements have returned to your normal pattern. Increase fluid and fiber in your diet. For birth control, discuss your birth control options with your health care provider. You may choose to obtain a method of birth control before resuming sexual intercourse. And in regards to sexual intercourse, nothing should go into the vagina the first 6 weeks after discharge. Sexual intercourse should be avoided until bleeding has stopped and the woman feels physically and emotionally ready. Okay, and I want to point out some warning signs when to call your healthcare provider immediately. If you feel Any pain, redness, warmth, swelling, drainage, or foul-smelling discharge from the incision or the incision begins to open, that's for the laceration or C-section. If you have discharge from the vagina that has a bad odor, severe headache or blurred vision or visual changes, temperature over 100.4, or you feel cold, feverish, with the chills. If you have any thoughts of harming yourself or the baby, if you have pain or burning sensation, redness, warmth, or swelling in your legs, breasts that are painful, swollen, hot, tight, itchy, or sore spots with redness or red streaks that accompany flu-like symptoms. If you have sharp pains in your abdomen, breast, or chest, if you have any trouble breathing, dizziness, or faintness, crying spells or mood swings that feel out of control, unable to empty your bladder or urination that is painful, difficult, or too frequent, or you have difficulty having a bowel movement. If you feel that you have to report any domestic violence or abuse at all, there's a phone number to call, 1-800-96-ABUSE. Okay, so now to start the instructions for your baby. First things first, we want to talk about safety. For sleeping, put your infant on his or her back to sleep always. Use sleep clothing, such as a one-piece sleeper instead of a blanket. Do not let anyone smoke around your child. Use a firm mattress and safety-approved crib covered by a fitted sheet. Car seats and other sitting devices are not recommended for routine sleep. Do not use any pillows, blankets, or pillow-like bumpers in the sleep area. Wedges and positioners should not be used. Keep soft objects, stuffed toys, and loose bedding out of the infant's sleep area. The baby should sleep in the same room as the parents, but not in the same bed. Avoid covering the infant's head or overheating. The bulb syringe, this is used to keep the bulb syringe near the infant at all times to clear the infant's throat or nose if necessary. Clean the bulb syringe well with warm soapy water after each use and allow it to air dry. Hand washing. Always wash your hands prior to handling your baby. Car seat. All infants are required by law to be in a car seat while the car is in motion. Children should be placed in a child safety seat according to state laws. In your home, the use of outdoor announcements is not recommended to announce the birth because they call attention to the presence of a new infant at home. Question any unfamiliar persons visiting your home or inquiring about your baby after discharge. Do not use any home monitors or commercial devices marketed to reduce the risk of SIDS. For behavior. Crying. It's a normal response for your infant to cry. The most likely causes for your crying are hunger, need for a diaper change, or needing to burp. You should burp your baby after each feed. So, information on calming techniques. If they are crying, calming techniques include feeding your infant, changing the diaper, gently rubbing the back or tummy, walking with your infant, rocking your infant, skin-to-skin contact, or giving your baby a pacifier. It is never okay to shake your infant. If you get frustrated or angry, put your infant in a safe place, take a break, and call a friend. For the baby's sleep patterns, infants require a lot of sleep. You should be waking your baby at least every 3 to 4 hours to feed. You should place your baby on his or her tummy each day for supervised tummy time. This will strengthen his or her neck and abdomen. For baby's diet, we'll start with breastfeeding. Your infant should breastfeed 8 to 10 times a day per infant cues. The positioning should be close to your chest while feeding. Your infant needs to be cuddled and skin-to-skin time is recommended. After feeding, hold your infant upright over your shoulder while gently patting or rubbing the back to burp. If you're formula feeding, your neonate is receiving a Similac or Enfamil diet. If your baby sleeps longer than 4 to 5 hours and misses feeding, awaken your baby. Your infant will generally take 2 to 3 ounces per feeding after the first few days of life and will need to eat every 3 to 4 hours. For the positioning, be sure to hold your infant close to you while you're feeding. Your infant needs to be cuddled. Never prop your infant's bottle to feed. Burping. Your infant needs to be burped every half ounce of formula. After feeding, hold your infant upright over your shoulder while gently patting the back. Newborn characteristics. There's a newborn rash. It's normal for your infant to develop a rash on his or her skin. It appears with small red circular areas with a white dot in the middle. This does not require treatment, and you'll generally resolve it within the first week of life. Avoid lotions, powders, and perfume soaps. Milia. Milia are pearly white bumps usually on the face, especially the nose. They will disappear within the first week of life. Jaundice. It's a common occurrence in newborns. Your infant may appear to have a yellow coloring to their skin. It will start in the face and progress down to the toes. If your infant appears more yellow in the next 24 hours, you need to call your healthcare provider immediately. Infant care. For bathing, your infant will need to be sponge bathed until the umbilical cord falls off. Using a soft washcloth and plain water, gently wash your infant's face. Bathe your infant from head to toe, saving the diaper area for last. Mild infant type soap may be used. Cord care. Keep the umbilical cord clean and dry. Cleanse with warm water and soap when soiled. Inspect the cord and surrounding skin with diaper changes, and notify the pediatrician if the drainage or discoloration is noted. The umbilical cord will generally fall off within the first 2 weeks of life. For the diapers, 1 to 2 wet diapers are normal for